All right, everyone, we'll get started. So we're going to record this, so we'll send it out to the entire group that we sent the email to. So thanks for joining us. We're just want to, obviously we're into hurricane season now, so we just wanted to give you all an update and some information about some really good tools that we're making available to the public in the case of a hurricane. So I'm going to pass it over now to Lavondra Dobbs, who is our CEO for VLink.
Thank you. Good afternoon. So I just want to give you a quick overview of what VLink is, what all that we do. If you could go to the next slide, Andrew. So we're an agency that has an office in New Orleans, but of course right now we're working remotely with everyone else. Hurricane preparedness is a lot of our tasks. It's something that we work towards being prepared for each year so that our services do not go down during a hurricane or flooding or pandemic events. So we do house a 211. We're part of the Louisiana 211 system. And we predominantly cover the 10 parishes. They are listed on the slide. But with our telephony system, we can work with the other two regional call centers and cover each other's calls or assist each other when volume is higher in one area of the state than the other, due to any number of reasons. So we work very well together. We're a little different from the other 211 call centers in that we're a blended center where we also do crisis work, and we handle crisis calls a number of ways. We can do those through 211, where if you dialed 211 in another region, because our call routing is based on the area code of your phone, and you can select the option when you enter queue to speak with a crisis intervention specialist, and those calls come to us. We also have some contracts with the Office of Behavioral Health to do crisis lines like the Keeping Calm Through COVID, that is being handled by VLink. Also the National Suicide Prevention Lifeline for callers in Louisiana. We handle those too. We also have contracts with OPH. We have a teen crisis text line that they help to support, and it can also be used for opioid addiction or information that teens may have. Coming soon is a statewide opioid text, where you would text to 211 and enter the keyword opioid. And you get assistance that way, either through some preloaded answers to questions you may put in there, or you may begin a text with a crisis intervention specialist. That option is available. That program is available now in our 211 area. We're expanding the resources to make it statewide very soon here. We also contract with DCFS during disasters. They have a contract with us to provide DSNAP information in times of disaster or hurricanes. So they would activate that contract if DSNAP is going to be available, and we would start pushing that message out through our text platforms with keywords or phone assistance. We also have many other crisis lines, such as the KID line for child abuse prevention. We do coverage for the Health and Human Service districts for LSU's phone, text, and chat. Just pretty much a wide range of crisis line. And of course, during disasters, we work around the clock updating resources that Andrew will show you how those are stored in Carla, the chatbot we've got that IBM helped us with. But people work around, our resource specialists do work around the clock in keeping up shelter information, sandbags, cleanup assistance, and some more. So during an event, the governor may say, I'm activating 211. That activation is important to us. Either way, we get a high volume of calls. If he makes the declaration, we are eligible for FEMA reimbursement. If he doesn't, we aren't. But that activation also makes us eligible to seek reimbursements for our calls. For example, right now, the COVID-19 hotlines are being handled by the 211s around the state. And that was an activation by the state. So we are having our costs covered there. And we have answered well over 100,000 calls since the last part of March with people having questions about COVID. Next. So here I'm going to let Andrew show you the tools that we have to assist you and the public during a disaster. I will say when we had our tropical storm Barry, for that long weekend when shelters were opened, we used our text bot where you would text to 211 and enter the keyword LA shelters. And that was being updated pretty much in real time from information we got through the EOCs about shelters opening and closing. So that was not only used by private citizens, it was also being used by organizations and entities like Second Harvest so that they knew what was opening and closing in real time. And we had over 54,000 people access that tool that weekend. Thanks, Andrew.
So thanks, Lavondra, for giving an overview of what VioLink does and what we do during a hurricane. So as I mentioned, the point of this call is to show you 4 different tools that we'll make available to the public during this storm. So I just want to walk you through what those 4 tools are. So this is a copy of VioLink's homepage. This is exactly what you'd see if you went to violink.org right now. The one difference is it's a staging homepage that also has the Cara Chatbot activated. So during a storm, this is what our homepage would look like. So this chatbot is another way that people can get in touch with us and get information. Our counselors will still be available 24/7 to answer calls if somebody wants to dial 211 or wants to do an online chat with us or send us a text message. But they'd also have this option on our homepage for the Cara chatbot. So here is the chatbot. As Lavondra mentioned, it was developed by IBM for us. It uses artificial intelligence to understand the requests that people have and share relevant information with them. So here's some sort of pre-selected information that people can ask for, but I'll say that somebody said, I need cleanup for my house. So they type that in and they get information about crisis cleanup, which I'm sure many of you know is an organization that has provided cleanup during a number of storms. So, obviously if crisis cleanup wasn't working during the next storm, then we'd change out this information, but people would get the phone number and, know how to connect them. Now, as I mentioned, it's smart technology, so they could just type in cleanup and they'd get the same information, or they could type in a range of different sort of prompts that suggest the same information is needed, and they'd get that information. Or they could say, contact FEMA. So if they would type that in, they'd get information for how to contact FEMA to get disaster program information applications or to find a recovery center near them. Let's say that they typed in, I need a shelter. So here, this takes them, gives them general information about what to bring to a shelter, and it also gives them 2 lists. So this list is a Google Doc that we'd be updating around the clock. We'd have a staff member placed at the state's EOC in Baton Rouge, and they'd be updating this Google Doc in real time with parishes all over the state that were available. So that's, that's an option that people would have if they wanted shelters. Now, this is all, so far I've just showed sort of general information for the state. Say if somebody wanted information that's more at a parish level, like boil water advisory. So they could type this in and it would ask them, what parish do you live in? So I'll type in Jefferson. So now right now it's set up to just show them template information about where they could find that information. During a storm, we'd update it with the actual information for the parish, but it would give them the information and then some general information about a water boil and how to deal with that. So those are 4 different things that you could type into the chatbot, but it's set up to accept a range of information. So there's a lot of different things people could use a chatbot to get information about. So that's the first tool, the Cara Chatbot. The second tool I'll show is an online publication of all of the hurricane resources that we have. So right now our homepage, as Lavondra mentioned, we have a contract with the state government to handle COVID calls. So we have this banner on top of our website right now that says COVID resources, FAQs, and information. But during a hurricane, we'd swap this out. So it would say for hurricane resources and data, click here. So people could click there and it would look a page very similar to this. Now, what we have right now on the page is a list of these Google Docs contain over 1,000 different resources. I think it's a really helpful tool for people, that need COVID assistance. So if they click on one of these, for example, right now it shows a range of COVID data, these and resources, these tabs along the top. If you click on the health tab, it shows, a number of different health resources, testing sites, etc., meal supplies. So right now they contain about 1,000 different resources for COVID, but during a hurricane, obviously these tabs would say things like sandbags, road closures, just information that people would need. So it's similar information to what is provided through the Cara chatbot, but it's set up so that people can scan large amounts of information at once. So it's just a different way to get information in a way that we think for some people would be the most helpful, especially for a government organization like yours to be able to just see mass lists of resources at once. So that's the second tool. The third tool that Lavondra mentioned is our text chat system. So people can normally text with us, with our counselors 24/7 to get, counseling or to get information referrals. They can just text their zip code to 898-211 and that'll initiate a text chat conversation with one of our staff members. So during a hurricane, that would definitely be available. And then we'd also set up automated text information that, say, the governor, for example, would help us get out there. As Lavondra mentioned, during the last tropical storm Barry, we had a system where people could text LA shelters to 898-211 and they'd get a list of shelters across the region. Lavondra mentioned thousands of people use that to get shelter information during Barry, or they could text DSNAP to get DSNAP applications and information. So we'd publicize different automated prompts that people can text to us and get up-to-date information. So those are 3 of the 4 tools. The last one that I'll mention is that VLink at all times collects a large amount of data. We work with, during non-COVID times, non-hurricane times, we work with about 50,000 people a year, and we collect a lot of data on them that we think is useful to government agencies and foundations and nonprofits, information about like what are the needs of people in Louisiana. During COVID, we're collecting a lot of health information that we're publishing. So, and all of that data is available all the time for free on our website. It's anonymous data, so it doesn't include information, about more than just sort of demographic level information. But so we would publish a separate dashboard that would be a hurricane dashboard that would show information about the calls that we're getting, the needs that we're getting. I'll walk through our COVID dashboard, which has the COVID data that we've been collecting. As Lavondra has mentioned, we have a contract with the state right now for 211 to be the official entry point for COVID information referrals. So this dashboard shows the COVID data that we've been collecting. This first page shows where people have been contacting us from. There's a lot of ways that you could filter this information. You could click on the parishes and it would filter it, or you could click here and filter it by zip code. Again, you could filter it by looking at it by parish or by different demographics. You could filter it by date. The second page shows reasons that people are contacting us. So this shows how calls have changed over time. You could click on one of these bars, and now this has been filtered to just show how general testing inquiries have changed over time. You again could filter this to look at just how testing inquiries have changed over time for Jefferson Parish. So this is obviously helpful information for or government agencies planning out testing locations, for example. And again, during a hurricane, we would populate a dashboard with hurricane information so that you all could understand what the needs of people in your parish are. Here's some maps and timelines that show for COVID of how needs for financial assistance and for food have changed over time. Again, there's a number of filters here that you could use to explore that data. So those are two. This is just one of 6 dashboards we have published on our website. A lot of them go into just sort of 10 years of 211 and other data that we've collected. So we think it's a rich data source, and we've set it up to make it very easy for people to explore. So those are the 4 tools that we would provide during a hurricane. The first is the Cara Chatbot. The second is the online publication of our resources. The third is the texting system that we'll have where people can easily text us to get information. And the fourth is that data that we would provide for people and for organizations like yourselves. So
I just want to add that in the Explore Our Data, the dashboards that are for normal times, those were the ones at the lower, 4 of them at the lower portion. Those update in real time every 2 hours. The COVID, the Keep Calm and COVID and the COVID data, is that within 24 hours now, Andrew?
Yep, generally 24 hours.
Okay. So we hope that, in a live disaster, we can move our disaster information closer to real time. Instead of 24 hours, that it would be within 2 hours, so we could see what's happening.
Great, so that's our presentation. We'll open it up now to see if anyone has questions about any of that. All right, I guess that we were very clear in our explanation. So if there's no questions, then Lavondra, do you have any final comments you want to make?
Feel free to reach out to us, to email me or Andrew if any questions come up about this. Please share that this tool's available. Parla will not only be available on our website, it'll be available on the 2 other call center websites, regional site websites, and the Louisiana 211 website. We're just trying to look at ways to get information to people as quick as possible because during hurricanes, we are really inundated with calls and you do get some wait times.
Great. All right. Well, thank you very much.
So, is there a question?
I did have a quick question. So this is Delia Blackwell from Washington Parish. you said that, you pulled information from the EOC centers, what they put into the web EOC. Is there a contact number or like a link to a website if we wanted to send in like information before, like the shelter counts? I know we do them twice a day. So if we wanted to send in, information before that second or in between that time period, is there a contact or a link that we can go to and give you guys that information?
You could always send that information to Andrew or to resources at ViaLink. We do, whatever information we get, we do verify it before we publish it, because we don't want to send it in the wrong direction. And we have had presidents give us incorrect information before, so we hope they're not offended when we verify it.
So,
Okay.
I'll follow up with you after the webinar and just send you an email just so you have my contact information. You can, as Olvandra says, just reach out to me during a storm and we'll coordinate that.
Okay.
And then
resources with if you have any new resources within your parish now you think we might not know about, we're happy to get those onboarded.
Okay. I did have one other question just out of curiosity. You said that, for instance, like whenever the state goes into, like with DSNAP, that you would push out information and everything through keywords on websites and stuff. What social media, or do you use social media platforms to push out information as well?
We do. Yep. We have a Facebook, Twitter, and Instagram accounts where we, post information regularly during COVID, for example. We've been posting a lot of information about SNAP applications. So we do use social media to get the information out as well.
Okay. Got it.
Great. Thanks for those questions. Any other questions?
Yes, I got a question for you. We've been trying to actually push out virtual public damage assessments via a link that we have. But of course, in our state, with some of the rural natures and poverty levels, we do have citizens at this day and age that don't have access to computers or internet. And so I was wondering if, since, 211 is the hub for a lot of information sharing, how easy would that be for your operators if they wanted to report damages? Could they enter data for citizens calling?
Where are you located?
State of Louisiana.
Okay, so it'd be a statewide, not a parish?
Well, it depends, because it depends on the magnitude of the storm. So like if it's like a Katrina or a Michael, we know that we can do public damage assessments a little bit differently, and whether that's flyover or something like that, we could actually do that virtual assessment a different way. But like recently, we did have during all this COVID stuff, we did have a tornado in the middle of Easter, which we had to do a virtual thing. And of course, it gives us the best data we can for those that report it, because we're trying to push that out and use technology to our advantage. So in some cases, it could be a parish level kind of scenario.
I know the call center in Monroe was doing some work around that tornado, because that touched some of the parishes that they covered. And we have, in disaster events, helped with getting people's, damage claims in, or just taking the information to share with the parish. Get that information. The best thing to do is work with that 211 ahead of time on what it is that you would like to, in case an event happens, what's the information that you want. I know the 211 in Lafayette, they do a lot of that, and they already have various call reports prepared, because their various parish officials have really worked with them and what they want. So so We could work
So
with
really,
it.
it's probably best building it at the local level so everybody has an understanding of what is needed
Yeah,
and how they're collecting it.
Because every parish wants something different, and we've done things for St. Tammany before at ViaLink, and actually, and then during COVID, we actually, you know, there's been various funds for hospitality workers to get some financial assistance, and for you know, the grocery workers to get energy assistance. And we were contracted to help them fill out their applications, those that did not have internet access, which was quite a few.
Wow, yeah, it's more than we expect it to be, yeah.
Yeah, so they actually contacted us, got them on a list, and then we would call them back and do their online application with them and get it submitted.
Okay.
So yeah, there are lots of options, but you know, if the parishes would be wonderful, could agree to a statewide format. Sarah worked a lot with LAUW. She coordinates 211 statewide activities for us, which is great. And we could just go ahead and have one call report ready for that type of information to send.
We actually are at that point because that's what we have been building this link for at least over a year to put it in place, and so we kind of use that tornado as a testing thing. But while I have you on the phone, because I know y'all are critical and also linking folks to immediate services, first time in history that our statewide state emergency management agency GOSIP actually was the applicant for the crisis counseling grant, and so the first immediate service program. And so we kind of reached out because we were trying to expedite a lot of different things. And I was wondering, as a part of some of the stuff that you do relative to that, are there resources? Do y'all have to upload the resources, or how is that updated on a regular basis?
So Andrew's got a team of folks that are constantly mining and requesting updates from individuals.
Okay, so it's the best you can. Yeah, okay.
Yeah.
All right. All right, thank you so much for answering my questions.
Sure, if you have any more, just please reach out.
All right, thank you.
Yeah, and as Lavondra mentioned, in addition to about 1,000 COVID resources that are published on those Google Docs, we have here our resource database, which has about 3,500 just, you know, non-COVID resources. So people can always go here to explore them. And as Lavondra mentioned, we have 3 full-time staff that all they do is find resources and make sure that they're up to date.
And our information and referral resources on our website are pretty much focusing on the 10 parishes we serve for 211, but our mental health, behavioral health, opioid resources are statewide, since we do statewide crisis intervention work.
All right, that's awesome. Thank y'all so much.
Yeah, you can always go to Louisiana211.org and get the resources statewide too. Yeah.
Great, thanks for those questions. Any other questions? Okay, well, thanks very much, everyone. Appreciate you taking the time. As I said, we've made a recording of this, so we'll share that later. And, you know, feel free to reach out to Lavondra and I if you have any questions or need further explanation or want us to walk through these tools again with members of your staff. So thanks very much.
Thank you.